that I've set up here.
Hi everybody, I'm Renza from Diabetes Australia, and welcome to today's live Q&A here on the Diabetes Australia Facebook page. Today I am joined by the ever wonderful and ever bright pink Cheryl Steele, and we are here to talk all things COVID, but specifically diabetes and COVID. But before we begin, I would like to acknowledge the traditional owners on the lands where we're all watching from. I am in Wurundjeri land. It is a beautiful day here in Melbourne today, and I would like to pay my respects to elders past, present and emerging. Cheryl Steele, thank you so much for joining us live from a hospital in Melbourne. Hospitals are under Code Brown. It's incredibly busy, intense. So we are so grateful that you have found time to join us today. Thank you.
Thanks for asking me, Renza. And I did wear bright pink scrubs on purpose because I wanted to let you know, even though we're Code Brown, it's not all doom and gloom. You know, we can still be at work and enjoy our role.
Wonderful. And I know that all healthcare workers are doing such an incredible job. I'm so grateful that we've got you working for us in our corner and talking diabetes. We did ask people if they had any questions about diabetes and COVID, because we're seeing so much chatter online about it. And so please, if you're watching today, you can ask us any questions that you would like. Just pop them in the comment section and we will hopefully get to them today. We know that this is a really confusing time. There's a lot going on. There's a lot of uncertainty. I'm living with COVID in my house at the moment. Lucky for me so far, fingers crossed, touch wood, throwing salt all over my shoulders and everything. I remain COVID free. I'm the only one who hasn't caught COVID. So I've got a question for you, Cheryl. I'm the only one with diabetes. Why don't I have COVID? I do know the answer to this, but could you explain, does it mean that I'm more susceptible or not?
No, you know, it's a very common misconception, I think, particularly amongst people with type 1, because I think autoimmune disease, there's something wrong with my immune system. And you know what? There's not. Right. People with diabetes, whether it's type 1, type 2, our immunity to any infectious disease is the same as anybody else's.
Okay.
So good to know.
Good to know. That I think is very reassuring for a lot of people. So Cheryl, let's start with maybe the top 5 things that people need to know about diabetes and COVID.
Well, I think first thing is prevention is the best option. So please, if you haven't already, get immunised. If you've had your 2 vaccinations, get your booster as soon as you're eligible. I think today they moved it down to 3 months from when you had your second shot, you can get your booster. I strongly encourage you to go out and get your booster, because it is shown that recent booster is more effective against the Omicron, which is the version that's running rampant at the moment. So that would be my first tip, is get yourself vaccinated. My second would be, if you do have to go out into areas that are high risk, wear your mask. I know it's uncomfortable for some people, but honestly, masks, especially the N95 mask, if you can get your hands on one, are shown to have amazing effects at protecting you. But also, if you were unknowingly in that infectious stage before you've developed symptoms, it also stops you passing it on to somebody else. Yeah. So they would be my top tips. And then if somebody, such as yourself, has got somebody in your household who's COVID positive, but you're not, that positive person should be isolating in their own home, away from the other household members if they can. So in a separate bedroom, if they have to share a bathroom, make sure they mask up before they go to the bathroom, that they clean it afterwards so that they don't leave anything on the surface for somebody else to pick up. If they're sharing a kitchen, mask up, clean everything afterwards so that you're protecting the other members of your household. I would say try and get hold of some RAT tests if you can, but I think that's like saying, can you get a ticket to the moon right now? Because the likelihood's about the same.
Yeah.
But the other thing to remember is, if you are concerned that you may have COVID, you can still go for a PCR test. Go to the drive-in services, and they're all over Australia. Wear your mask and tell them that, you know, you're a household contact, you're concerned. They will either do the test there, or they will give you a RAT test to take home and do. So you can get rat tests by going to the testing centres.
Yeah.
But if you think you might be positive, drive-in is probably your best option. And then I guess our other best defence as people living with diabetes is to try and keep our diabetes as well controlled as we can.
Yeah.
And, you know, for some people, that's really difficult. They have all sorts of life events that are affecting them that make managing diabetes tough. But, you know, the better you can get your blood sugars, the closer to the normal range, then there's more hope you're going to have of fighting off anything that comes your way. Have I got to 5 yet? I've forgotten to count.
I think you have, but we're going to probably expand on some of those because I think they're all really, really critical points. And I do appreciate that you have acknowledged that getting rat tests is really, really hard. I know. It's tough. And there is a website called Find a Rat that is being updated in real time. So if you want to get on there and have a look, see if there's anything available in your area. But yeah, what I've heard from people is that the best luck they're having is driving up to the drive-through centres, and they may find one there. Hopefully,
I know in Melbourne, if anybody's from Melbourne, you can go to Gate 7 of the showgrounds.
Yes,
and they will give you rat tests.
Yep.
So that's one of our hospital network testing sites. So I know that one for sure. But others, I know if you present and you're a close contact but asymptomatic, often they will just give you a rat test to take home rather than doing a PCR test, which is actually beneficial for everybody because it means now we're not inundated with people having PCR tests. So if you are positive and getting a PCR, you get the result much quicker.
That's right. Yeah.
So instead of taking 5 days to get a result, now usually within 2 days you've got a result. So I think that it does help everybody, and hopefully rat tests will become more freely available to people. And I hope it is free.
Yeah, I know.
It makes it tough when they say they're only going to give free to, you know, pensioners and card holders, because it's those of us going to work who really need them the most.
That's right.
Because we want to make sure that we're safe and we're not taking something to work to infect all our co-workers.
Exactly, keeping others safe. Now let's start. You mentioned right out of the gates there, we have done a number of sessions on vaccines, but we're going to just touch on this again because I think that your messaging there is just so critical. If you haven't had a chance for whatever reason to have your initial 2 shots, everybody 5 years and over is now eligible. So please go and get vaccinated. And I'm probably speaking to the converted because Australia's vaccination rates are some of the highest in the world. It's amazing, but it's not surprising. Australians have always had high vax rates. Our childhood immunisation register is incredible, and vaccination rates are, you know, it just goes to show how much people care, obviously for wanting to keep themselves and their families safe, but our loved ones and people around us as well.
Absolutely. It might not be your life that you save. It might be your elderly relative or your immunocompromised friend or
neighbour
or something.
That's right. Yeah, absolutely. Yeah, but boosters is a bit confusing because they do keep moving the goalposts. So
yes, they do.
Boosters, yes, but currently, if you are 18 and over, you are eligible for a booster 3 months after you had your second jab. It's just come down to 3 months. So
it has.
Make an appointment. There is, I know in Melbourne there, and I think in other places too. We're both from Melbourne, so I apologise for the slight bias there, but I know that there is a booster drive. Sounds so much more fun than it really is, but a booster drive this weekend. So really you can walk around somewhere, roll up your sleeves, and you're going to be able to get a booster. They are everywhere.
You don't even need to book an appointment. Lots of hospitals are doing walk-ins now where you can just, you know, particularly the big hubs, you can just walk in, line up, get your booster.
So please do that. And the boosters that are available now are Moderna and Pfizer. So they are what is available to you, and speak with your healthcare professional about which one might be or when you get there, about which one might be the right one for you. Now, if you are 12 to 17, you're not eligible for a booster, but again, super high vax rates in that age group. And then we've got our littlies, our 5 to 11-year-olds. that's just started rolling out. So in that age group, the kiddies have probably only had their first shot. But how amazing are these gorgeous kids lining up?
I know, they are so lucky to have the opportunity, first of all, to be immunised. But, you know, I'm sure it's the same all over Australia, but in Victoria, they've really, DHHS, gone out of their way to make the immunisation hubs child friendly, and, you know, can't really be that entertaining getting a shot, but they've done the best they can to make the kids feel safe and secure. They've done an amazing job. They've put a lot of thought into how to make it as convenient as possible for both the children and the parents. So, you know, I think with school going back,
I know,
it's, you know, if you can get it done. I know at our hospital, we're now offering over the weekend walk-ins for 5 to 11-year-olds. Don't even need an appointment. So, you know, line up, get them protected, and let them go back to school and not having to keep taking time off because they get sick.
All right, now let's talk about, because you did mention if there is sorry, I've just got that there are a whole, I'm going to have to look at my phone in a minute to have a look at the comments that are coming in. But before we do that, let's talk about trying to keep your house COVID safe, I guess. So let's talk about, you know, if you're coming in from the outside, these are really practical questions, everyone, points, everyone. I do know that, but it's probably a good idea just to have them reinforced. So you've been out, you've gone to do your Woolies shopping or Coles shopping or whatever. You've come back home. Let's talk about, you know, washing hands.
Wash your hands and use just your normal everyday sanitizer to make sure there's nothing sitting around on your hands, on your shopping, because you're going to be handling things and you don't know if on the supermarket shelf somebody's picked that up and put it down again or whatever. So sanitize, and then sanitize some more would be my recommendation. And then, of course, you're putting all your things away. You know, a lot of people have resorted to online shopping now. So you don't even have to go to the supermarket. And I can tell you from personal experience, you don't buy as much junk if you shop online because you don't see it.
The impulse buying is
I'm
less.
pretty sure I needed one of those when you know you didn't. It was just an excuse to buy it. So online shopping's always an option, and they're very safe. They leave it all on your doorstep, ring the bell when they're finished, and you just bring it in yourself. Masks outside, but you don't need them inside the house unless you've got somebody in the house that's COVID positive.
I'm wearing one every time I leave this room.
And I think that's the safest way to be. I would normally have mine on, but I'm here by myself, so I have to put it on as soon as I finish talking to you, but I didn't want to look like I was I wanted to show my face to people.
We're thrilled that you have, but thank you.
I think that those sorts of things are going to keep you safe.
Yeah, good. All right. And so I think that's important. Now, if you are, so I might just have a couple of minutes just to say some things that I've been trying to do here. So my husband and teenage daughter are both positive. So they're confined. So my daughter's in her room. My husband is in our bedroom, and they're confined to that space. We are a 1-bathroom house. So we are having to, they're having to make sure that they wipe everything down, just as Cheryl said. Flushing the loo with the lid down is really important. So hopefully people do that anyway, but just in case you don't, pop the lid down first. It was also suggested to me the other day that I wait for half an hour before going into the bathroom once they've been in there, and that's what I've been trying to do. And I know all of these things are, you know, in perfect world, but I have been wearing a mask. I'm the only one who's doing allowed in the kitchen. I'm delivering food and all sorts of things. We're lucky we've got a lovely garden, so they are obviously outdoors and are eating outdoors, which, you know, we're lucky that it's this time of the year, but it is tough. But you know, they're trying to protect me, and I'm trying to stay protected as well, and we're seeing just how we can minimize these risks and stop what is an incredibly infectious variant of COVID.
It is so infectious.
So that's just some ideas of what's working here. Okay, we have got some comments. So something about disinfectant. Does Glen 20 stop it from being spread? God, I hope so, because I'm emptying
Yeah,
cans.
it can. Yep, any sort of surface type disinfectant, Dettol spray, Glen 20, any of those things on the surfaces.
Yep.
It doesn't live for a very long time on surfaces, but long enough if you go in straight after somebody else and touch, you could pick it up. I even now spray my outside door handles.
Yep.
Just in case.
Same. I'm doing that too. And one of the things I'm very lucky that I have extended family who live nearby, and so I'm having because I'm a close contact, I can't leave the house either. So my beautiful sister is doing morning coffee runs, but I'm making sure that the gate's even open for her, so she just has to leave things down. She's not able to touch anything, which I think is probably a bit of overkill, but I feel like the last thing I want is for her to catch COVID from our plague house.
Well, that would stop your coffee run. You can't do that.
Exactly right. She needs to stay healthy. Okay, here's another comment. Pregnancy and all kinds of diabetes, please speak to your midwives, CDEs, endocrinologists and obstetricians about vaccinating in pregnancy. Let's talk about that. If you're pregnant, you should have a vaccine still, right?
Absolutely. Yep. Still have your vaccination, because some of those antibodies go across to the baby, and you will be protecting your baby for the first weeks of its life. They can't get vaccinated themselves till they're 5, of course, but yes, definitely get vaccinated. Yeah.
Okay, good. Let's talk about vaccine reactions, because we've got a comment. Somebody said, let's talk about vaccine reactions and specifically glucose levels. So somebody said that after they received their first Pfizer jab, they spent the day after, or for about the next 12 hours, fighting off extreme lows and finding it hard to stay above the 4 mark. And I've heard of people who have the other.
Yeah, I was going to say, personally, for me, I had the opposite effect.
And I had nothing.
Very first Pfizer, I had no reaction.
Yep.
The second one, it was about 2 days after the shot, I had, and we almost timed 10 hours of higher blood sugars, where I was having to put temporary rates in all the time. But after that, back to normal. My booster, which was also Pfizer, I have to say, honestly, nothing.
Yeah.
I wondered if they gave me water by mistake, because no sore arm, no reaction, but everybody's different. And I think that's one of the things about living with diabetes. We might all have diabetes, but you know what? We're all different. And just because I had a high blood sugar after I had mine doesn't mean to say that you will. If you had a low blood sugar, then that's perfectly valid for you. So you would reduce your doses if you can. If you're on a pump, if you're having shots, sometimes you can't suck it back out once you've given it bad luck. But then you just have to treat the hypos. But I think, even some people who had AstraZeneca got cold-like symptoms after their first or second shot. But you know what? It usually only lasts for a very short time, and it's so much better than getting COVID.
Yeah, absolutely. So I had my first 2 were AstraZeneca. I had nothing. I was sore at the injection site if I pushed it. So my mother said, "Don't push it." She's that's
the common treatment for things that are sore when you touch them.
Don't press it. Great, Mum. Thanks for that. And I had Pfizer as my booster. I had a slightly sore arm, but that was pretty much it. But when should you start to be concerned? Like if your blood sugars are if you're really struggling, at what point do you say, you know what, I'm going to pick up the phone and have a chat with someone about that?
I think if you can't, using your normal sick day management plan, if you can't control your blood sugars, or for those of us living with type 1 or with type 2 who are taking that class of drug called an SGLT2, if you start showing ketones, that's a sign that your body's not coping. You need an intervention.
Okay.
That's from diabetes point of view. If you're positive for COVID, there's also the things with shortness of breath and those sorts of things that, of course, are going to be a trigger that you need help.
Yeah, and we're going to talk about, we're talking at the moment about doing everything we can to prevent COVID. We will talk about what to do if you are diagnosed with COVID in a minute. So somebody's actually, let's jump to that, because we've got somebody's asked that question. Does COVID wreak havoc with glucose levels? They've said particularly in kids, but let's just talk across the board.
Yes, usually for people living with any sort of diabetes. It's like if you get any illness. When you get an illness, your blood sugars tend to go up because you become insulin resistant. So if you're on insulin, you're going to have to adjust your doses. If you're lucky, you've got a sick day management plan that's been written for you that might say, increase your insulin pump rate by this. If you're on injections, give 10% more than you would normally give, that type of thing. If you're on tablets, that's a little bit harder, but
Okay.
you should liaise with your GP if your sugars are high to see if they think you need to increase, because some of those oral hypoglycemic agents, if you're already taking the maximum dose, taking more doesn't do anything.
Right.
So
Okay.
it's important for that sort of thing that you talk to your GP, but usually, and then monitor more often. Normally you're checking your blood sugar every 2 to 4 hours, depending on how high it is, checking your ketones every 2 hours if you've got type 1, or if you're on that special drug that some of the people with type 2 will be on. Now, I can tell you right now, before you get COVID, make sure you've got some ketone testing strips, because they're often very hard to get at the pharmacy. And it's always the time you need them that you discover they're expired, or that your pharmacy hasn't got any. So, and normally the pharmacy won't order them in unless they know someone's going to buy them, because they have an expiry date. So, I think everybody living with type 1 should have a packet of ketone strips
and
in
a meter.
their house, waiting, just in case.
Yes. And,
Yes,
and a ketone meter with a battery. Yes.
All those sorts of things. Being prepared. Then, I always think with my ketone strips, if I throw them out when they've expired, good for me. It means I haven't been sick. But if I do get sick, I've got them there if I need them.
Absolutely. So that's right. I think there's some really great information out there about, what to have in your COVID prep plan, if you don't have diabetes. So it is things like making sure there are lots of masks, making sure you've got disinfectant, making sure that if you can get your hand on rats, getting those, and oximeter, all of those sorts of things, really great. But there are extra things to think about if you have diabetes. Hypo supplies, just in case you go low. Ketones are important. What about things like hydrolyte, or things to keep you hydrated?
You can. Look, a lot of people, the most common symptoms with Omicron are temperature and upper respiratory symptoms.
Okay.
So, taking something for your temperature. Now, if you're using, CGM and you're on a Dexcom G5, preferably not Panadol, choose Nurofen. Well, if you're on G6, it doesn't matter. Or any of the modern ones, you can take paracetamol with them, or Nurofen, something to control your fever. And yes, you want to stay hydrated, plenty of fluids.
Yes.
And whether or not that's, just water, or if you're not eating so well and you've got diabetes, maybe some of your fluids need to have some glucose in them just to keep your glucose levels up. Some people do with Omicron, and especially with Delta, get diarrhea. So you need to make sure then that you're keeping your hydrolyte, with your replacing your enzymes and vitamins and minerals that you're losing. Vomiting isn't quite so common. Of course, for people living with type 1 diabetes, if you start vomiting, that's a cue to be checking for ketones, and maybe, you're not managing enough at home and you need extra help.
That's right. And don't be afraid to call for help if it's an emergency or you're really concerned. Yeah, absolutely.
You're better off to call early on. And, most diabetes services like ours, we've got a diabetes educator manning the phone, basically 8 hours a day. So that if you're concerned, ring your local hospital, ask to talk to the diabetes team, get advice. Don't sit at home thinking I should be able to do this myself, because sometimes you just can't.
That's right. I mean, diabetes is tough enough as it is. Add
something else. Yeah, exactly right. So it's okay to ask for help if you need it.
Yeah, absolutely. Okay, so this is actually a really good point. A conversation about being aware that your insulin requirements might actually also increase or change if you're in isolation. I haven't left my house for 4 days, I think it is now. Today's day 5. Haven't been able to go for a walk. Even if a walk was just to my local cafe, I'm pretty much, other than running around and delivering food for the people in the house, I'm staying put. What do people need to think about if they're ordinarily?
So if you are less active, you may well need extra insulin, because activity makes you more insulin sensitive, and suddenly you're not. But also, if you're stressed, that can put up your insulin requirements as well. So check if you're lucky enough to have a CGM, check your CGM and play by ear, see if you need more insulin. If you're finger pricking and you're stressed and you're not as active as you were, you may well need to increase your insulin as well. So yes, it's not just for illness, it's just change of routine, maybe change of food. If you're in isolation and you're not getting your normal requirements, for food that you'd eat, but you can't be fussy because someone's delivering something to your door, that might also be changing. Not everybody's lucky enough to have a system. We have a helpline that we send out. We've got here nearly 500 COVID positive patients that we're caring for in their homes.
Right.
So if they've got nobody else to deliver groceries, we've got a helpline to the government where, they'll come and drop off emergency supplies, but you can't say, I only like pink lady apples and I only like this. So you might get something that's not your favourite food, and you've got to accommodate for that too.
Absolutely. Yeah, I know. And I think that's part of this, is that flexibility and being able to pivot and change and manage with what you've got. I think that's what we're having to do.
We need to be adaptable and flexible, I think. But, at the end of the day, I'm absolutely positive, despite the fact that I'm sitting here in a code brown hospital wearing pink, trying to be bright, I am optimistic that we will get through this. And, who else can say, I've been in nursing for 50 years, and I can tell you this is the first time I've ever experienced anything like this. And, it's happened and we'll learn from it.
Yeah.
And, my expertise on a computer has grown exponentially because I've had to learn.
Because we've been doing this so much. Yeah.
Yeah, exactly. And, I still have the times when I've said something I think is terribly profound and then somebody says you're on mute and I think, this is my opportunity. But, things like even doing your banking online, you might not have wanted to do that before, but now you can because you've got it.
That's right.
So I think, yes, there are lots of frightening things, there's lots of negative things, but we can also try and look for some positives as well.
Absolutely. And keeping connected is really important, I think.
Absolutely.
Well. I know that there are a lot of people who live on their own, or, they're not able to keep in touch with their friends the way they would like to. So trying to find connections in some way is really, really important. That's
exactly. Even if it's online support groups, find somebody in a similar situation to you, or even if they're not in a similar situation, someone who can listen and say, I can feel your isolation. I can feel how, you're going there, and just support. I think that's so important.
Yeah. Now, Cheryl, there's so much chatter at the moment. We're, a week and a bit maybe, or a week out from school starting. Those little primary school age kids have only had the last week or so that they've been eligible to start being vaccinated. So they certainly won't be vaccinated, or fully vaccinated, I should say, by the time school starts. They're, should I send my kids to school? Should I not send my kids to school? I'm seeing this question asked so much. Obviously, we're not asking you to answer this for every person, but what are some of the things people need to consider?
I think for a start, going to school is important for your child's both, education, but also their social development. They need that interaction. And I think schools are putting lots of things in place to keep the kids safe. But, it's really hard to say to a 5-year-old, don't hug your friend in the playground when you see them for the first time. But, try and encourage them not to be so huggy kissy as, little kids want to be. Yeah, exactly, which is hard. But if they can tolerate wearing a mask, it's a good thing. Get them to sanitize their hands. Even if I've got a little sanitizer thing that's on a hook that I can put on my backpack, so that if I'm out and about, I can sanitize. Try that for your kids at school. Pack them lunches that they can eat without, relying on the tuck shop and that sort of stuff if you can. But I would definitely, if at all possible, send them to school. Being aware that if they do become unwell, hopefully the schools are going to have rat tests, so you can check your child and make sure that they're negative before you send them to school. But I think like anything else, when your child's going to school, if they're unwell, you don't send them because you're not going to learn. So I think that's the other thing too. And, you need to be flexible, because if you're a working mum or dad and, you want your kid to go to school so you can go to work, it can be tough.
Yeah. Absolutely. Now keep those questions coming because we still do have more to get through. In fact, just excuse me for a moment while I jump on and make sure that we've answered everything that I know that we were sent beforehand, because there were lots of things. One of the other things that I wanted to ask was, okay, so somebody said, what are the likelihoods that somebody might get complications from COVID if they're diagnosed afterwards? Let's talk about what happens after COVID.
Complications of COVID or complications of diabetes?
No, of COVID.
So with Omicron, there doesn't seem to be a lot of after effect type complications. With Delta, unfortunately, there are complications. Delta seems to have the ability to seek out weaknesses in your body. It's not just a disease of your lungs like Omicron. So if you already had a bit of a dicky heart, it can actually cause pericarditis and issues with your heart, and similarly with other organs. And there are people that get a condition called long COVID, where those symptoms will persist for a long, long time. Otherwise, people do tend to make a full recovery. Some longer than others. You know, we've had some people in hospital for months.
Right.
Others come in, become stable, go home, still get care in the home, but recover. So there are some people that are left with complications, but for most, you will recover, and life goes on.
Yep. Now we're not in lockdown, so we are actually allowed out of the house, obviously, and we can go for walks and we can do all those sorts of things. And we can still also have medical appointments, which again, they didn't stop during COVID. So let's just talk about how important it is to keep up with screening and things like that.
It's very, very important because you want to stay your healthiest when, you are at risk of other things. So very, very important to keep your specialist appointments. And nowadays, often they don't have to be face-to-face. They can be telehealth, they can be telephone, or they can still be face-to-face. And, now I think pretty much all over Australia, you can go back and sit in the doctor's waiting room. We did go through a period where you sat outside in the car, or if you didn't own a car, you sat outside in the rain until they rang you to come in. But yeah, pretty much that. Now you can go and sit in the waiting room, but also remember things like podiatry. Go and see the podiatrist and make sure that your feet are nice and healthy. Go and have your eyes checked. Make sure that your vision is being looked after. Don't leave everything to the last minute, or don't forget it, because it's still very important.
Absolutely. I think that that's really one of the things. I know that I postponed one of my eye appointments. This was early on, and I just delayed it for a couple of months. But at that stage, we just weren't sure about everything. But, I get checked every year. So I had last year's check as per normal. And this year I think it's in April that I go and get I go and get my eyes checked. I know that there are good reasons why we may be thinking the last place I want to be is any sort of doctor's office or anything, but it is still important. Diabetes doesn't go away just because we're in a pandemic.
No, and diabetes doesn't care what else is out there. You still need to be looking after it. And I think nowadays, optometrists, all those places where you're going to go and they're all very conscious of all the safety precautions to take to keep everybody safe.
Somebody has said, is Delta still about, or is it? So we're still dealing with. Okay.
Omicron is taking over for sure, but there are still cases of Delta out there. So I know you haven't asked me yet, but I'm going to say it. Please don't go and deliberately get COVID.
Yes, good.
I've had several people lately, patients, who've said to me, I think I'll just go and get it and then I'll be over the worry. But, there are some people who, for reasons we don't understand, have a very bad outcome. So, your first choice should be to avoid it. If you do get it, then you cope with it and manage with the best way you can. But don't go out and try and get yourself infected, because you might be that unlucky person. Might think you're going to pick up Omicron and it's going to be, like a head cold, but it could be Delta and it could be deadly. So, avoid it if you can.
Yes, COVID parties, not a good idea.
No. I know when I was little, we used to have chickenpox parties and parties and things, but we've moved on since then.
Yes, don't do that. We know more about infection control. Do everything you can possible to prevent it.
Exactly. That's what history's for. I always say history is for us to learn from and not make the same mistakes.
Absolutely. I think that's exceptionally good advice there. One of the things that I keep hearing from people is that they do think it's just a cold, and it's nothing. It's just going to be a cold. Fortunately, most of the people I know who have been diagnosed with COVID, it does seem to have been Omicron, and it was quite mild, but that doesn't mean that it is just a cold. It is still something that is serious and that we need to take seriously. Is that the way we should be thinking?
Yeah, I think so. And yes, in a lot of cases, Omicron is really a bad head cold for most people, but for other people, it's not. And, there are still lots of people getting admitted to hospital. And one of the things that makes me angry is when they say so many people died, but they all had comorbidities or they all had something else. You know what? You could have lived with that something else for a very long time. COVID made the difference. And so it is true that COVID is killing a lot of people still, and there'll still be more to come. There's, it's into the nursing homes now, and once it gets in there, it's, for a lot of older people, it's deadly. So it's, yes, for some people, the course of the disease is quite mild, but there's no way to pick if you're going to be that person.
That's right. Absolutely. And so please understand, we're not doing this to try and scare you. We do not believe in scare tactics. That's not
absolutely
what we're
not.
These are what the facts are, and we're trying
to
be
armed with the facts so you can make an informed choice.
Yeah. And do the things that are part of, trying to protect yourself. What do you say to people, Cheryl, when they say, well, what's the point of getting vaccinated? There are so many people who are vaccinated, but we're still catching it. How do we, I'm so frustrated that people.
That's true, that you do, but you don't get it as severely. If you are vaccinated and you're unlucky enough to get it, you will have, on the whole, a very mild disease. Because your immune system already recognizes it when it attacks. And so you're half prepared, shall we say. So it's still important to be vaccinated, because I can tell you right here, most of our people who are in hospital are not vaccinated.
Right.
And, we've even started up now because people come in sick and suddenly they want to get vaccinated. We've got, would you believe now, mobile vaccinators going around the wards and giving people vaccination while they're in hospital.
Right. Okay. So yes, and so what we're hearing, and we're hearing these statistics just about every day, the majority of people who are in ICU, who are really unwell, people who are dying, are unvaccinated. And this is not to blame and shame people who are not vaccinated, but we're just saying the evidence is very, very clear that vaccination will protect you. So please go and get jabbed. Please go and get jabbed. Yeah.
I couldn't endorse that more.
Yeah, good. All right, let's see. We'll just take there are couple of last questions. Let's bring them in. But Cheryl, I want to ask you a question. So I am on hyper alert in my own home. So one of the things that I'm doing is I'm keeping very, very close eye. I use a continuous glucose monitor, and I'm keeping very, very close eye on what my CGM is telling me, because for me, it's always been an early warning system. Often before, if I've had a cold or tummy bug, something brewing, my Dexcom graph tells me beforehand. How reliable is that as a predictor? Because mine right now is behaving itself beautifully.
Yeah, no, it's a great, I find the same thing.
Yeah. Okay.
If I'm coming down with something, always my CGM graph will sneak up. But also probably people doing finger pricks too. You notice, every morning I get up, my sugar's sitting about 5, 6. All of a sudden it's 8 to 10.
Yeah.
That's often a sign that something's brewing. And, you need to be on the alert and look out. And, sometimes it might be you have a couple of days of higher sugars and then nothing comes of it. And you think, but that could have been some sort of subclinical infection. That's going on that your body's managed to fight off without you actually feeling unwell.
Yeah. So absolutely. So even if you don't have any symptoms, if you're noticing that you've got higher than usual glucose levels, think maybe it could be something going on, and think about what you need to do about that. Really make sure that
let your little alert feelers go up, and be on the lookout.
And, you know, if you're going out, make sure you're wearing a mask and doing things to protect other people, because it could be when you are asymptomatic, but you're still contagious and you're still.
Yes. And often you're contagious for 2 days before you get any symptoms.
Yes. Okay. All right, Cheryl, thank you so much. Before we wrap up, I just want to talk about, we've got a campaign running at the moment called If I Had Known. It's really aimed at people with type 2 diabetes, and we've got some incredible stories of people living with type 2 diabetes about what they wish they had known before they were diagnosed or at the time of their diagnosis. If you have a look at our socials, you can read some of these stories. Our next Q&A next Thursday, I'll be speaking with some of the people who are involved in that campaign. There's some really lovely tips and tricks there that people have shared. I am always one to hear stories of people living with diabetes and how they are and how well they're living with diabetes and what their struggles and the challenges are, because it isn't all, you know, bowls of cherries and puppy dogs and rainbows and lollipops. And so I think that this is a really great campaign. It's a peer campaign of hearing from other people living with diabetes. Please do go check it out and join us next Thursday. Cheryl, thank you. Thank you so much. I'm always so grateful that you make time for us, but making time for us right now is just truly remarkable. Once again, going above and beyond to support people with diabetes in Australia. Thank you so very much.
My pleasure. And to everybody out there who's listening, stay well, stay safe, and see you next time.
Yes, and if you've got any questions or comments, please do come to us at Diabetes Australia and we can certainly help you. I know that there is great information on Department of Health websites, whether it's state or federal, but unfortunately there's not really necessarily much diabetes specific stuff. So please do ask us, and we can, if we can't help you, we can certainly direct you in the right place for people to help. Use your healthcare team, because I know that they're all inundated, and you know, but if you do have some questions that you really need answered, please do go to them, and don't just sit at home and think you're the only one going through this. A lot of people are experiencing the same thing. Thank you so much. We'll be back next week. Liam, we can end the broadcast now. Thank you.